Hi, everyone. Okay, so my goal for this presentation is to give you some insights about what we at Instiglio have been learning as we have been implementing development impact bonds, social impact bonds, and results-based financing programs in emerging markets, and also to give you some insight into the projects that we've been working on. And I'll do that by sharing 3 lessons and then supporting those lessons by showing how they apply to the projects. So first, by way of introduction, Instiglio is a not-profit organization that is dedicated to the proposition that funding in international development ought to be intimately tied to social outcomes. And we advance that proposition by working on what we broadly call results-based financing, which we think of as a family of programs in which a funder, whether it is a government or a donor, pays for results to a nonprofit that is either an NGO, a nonprofit, a social enterprise, and so on. Instiglio is about 2-3 years old, and it has been testing the development impact bond model across a range of different social issues, from education to workforce development to a variety of global health topics, and also across a number of regions. So we have projects in Latin America, we have projects in Sub-Saharan Africa and in India, and so on. So now I want to kind of lay out the framework for how we thought about the things we've been learning so far. And the framework is very simple. Basically, we think of, as I mentioned, RBF. So now we're going to get into some acronyms. RBF as the general field of outcomes-based funding. And within that, there are a variety of different types of models. And of course, development impact bonds is one, social impact bonds is another, and there's an entire alphabet soup within that. But the way we differentiate them, and I'll differentiate them for the purpose of this presentation, is that RBF is basically, we think of it as where donors pay for results, or governments, and NGOs, service providers, they finance their own work. Whereas, of course, in SIBs and DIBs and all these impact bonds, an investor finances that work, and either a donor or a government repays. So that's to set some definitional context for this. And now on to the lessons. So we have, I counted maybe 24 different projects that we are either working on or have already completed at Instiglio in the space of results-based financing. And these are either studies about how to design a development impact bond, scoping studies, feasibility studies, or designs, or market building activities, such as the Inter-American Development Bank's SIB fund, or other market building activities, such as a legal report we put out about how to overcome various legal obstacles to deploying these models in emerging markets, and so on. And I'm going to talk about 3 lessons. One is RBF, we have found, is sometimes a useful precursor to DIBs, and I'll explain what I mean by that. The second is that outcome payers, again, we have seen in our projects, often are indifferent as to whether a project they are funding is an RBF project or a DIB project. And then the third lesson is that when designers or outcome payers or NGOs move from an RBF to a DIB, investors need to take care to keep service providers incentivized. And I'll dive into what each one of these means. First, what do I mean by RBF is sometimes a useful precursor to DIBs? I basically mean that there's sometimes a benefit to having an RBF instead of a DIB. In other words, there's sometimes a benefit to having a service provider take on a small exposure to risk, be able to demonstrate to outcome payers and investors that it can take on a contract where it is paid on results and then implement and then get paid on results. And it is sometimes helpful for these service providers to take that time implementing that model to test out its existing performance management system and understand whether it's adequate, and to build on that performance management system as it understands what it actually needs, what types of competencies it needs to develop to execute a DIB. Of course, the drawback of RBF, again, as I've defined RBF in here, is it tends to be smaller, thereby less socially impactful, and it delays the time to get to a DIB. So if you want to do an RBF project as a pilot, that's an extra piece of time that perhaps you would need to add on to the DIB development process. I have two exhibits to demonstrate this. The first is, so Exhibit A is when an NGO came to us in Colombia, and they said, you know, we want to focus, we focus on primary and secondary school students. We want to do a development impact bond around that target population, and we want to focus on enrollment outcomes and learning outcomes. We want it to be fairly small, under $1 million. And we looked at them and conducted a gap analysis of their capacities when it comes with respect to a DIB, and it was basically very simple. This was an NGO that was small. It had very motivated, very serious leadership, but it just wasn't there yet with its performance management systems and its data. So in terms of its ability to say, do we deliver impact? Can we demonstrate that credibly to investors? It just wasn't there yet, which is fine. A lot of NGOs fit under that umbrella. To that NGO, we said, what you need, the recipe for success here is a performance management review, a review of your systems, an understanding of how to build capacity for these systems, where you need to get to in order to be ready for a DIB, and we can provide all of that. So that's a very simple one where we stepped from a DIB to an RBF, and we said, before you even get to an RBF, let's look at your performance management system, then maybe we'll do a DIB. Another exhibit is an NGO that came to us from Chiapas in Mexico, and also in education, looked at secondary school students, and it said, you know, we want to focus on enrollment outcomes, which is a very serious outcome in Chiapas, a very important politically and socially outcome. And we want, again, to do a development impact bond. And we had the same scenario where we had an NGO that was small, an NGO that was, this time we found, had the performance management systems, had the data, but in terms of its size, was not DIB ready. And then when we turned around and looked at the government and looked at other potential outcome payers, again, we found that there was interest there, but it wasn't at the level where we could convert that interest into a desire to either fund a very large feasibility study to execute on DIB design or something similar. So again, what we said is what works for you at this point is a results-based financing program where a government is a bit more willing to enter into that. It's a bit less complicated, a bit fewer stakeholders. You can test your ability to deliver on results within this model. You can build out your performance management systems. You can demonstrate this approach to a state government. And in this case, I apologize for the misnomer, it says a DIB. We actually took them from a SIB, which is where they wanted to go with the state government. We took them to an RBF contract. And they went through the process of designing that contract. They successfully signed it as one of the few state results-based financing contracts out there that is focused on education. They are starting to implement services under that contract, and they're going through that process. They're demonstrating to the government that this is an appropriate instrument, preparing for a much larger program, one where the amount of risk they would take on is beyond them, and they would have to pass that on to investors, and so on. So again, RBF being the first step to what would ultimately be either a social impact bond or a development impact bond. So that's lesson one. RBF sometimes a useful precursor to DIBs. Another lesson, and this one I think is really interesting. We have seen that outcome payers often are indifferent between whether they're paying for an RBF program or paying for a DIB program. And here's what I mean. Some of the outcome payers, certainly not all, some of the outcome payers we have worked with focus their attention on what outcomes are we purchasing improvements in reductions in diabetes, improvements in education and learning, improvements in employment, and so on. How much are we willing to pay for these outcomes? So what is that success worth to us? And what level of certainty do we need to know that the outcome has been achieved? Very reasonable, simple questions. What we've seen some of these outcome pairs not be focused on is, what is the right structure to deliver this outcome? Should I actually have investors or should I not? How much risk should the provider take on? How much would that provider's cost of capital be if they took on money? Those are questions that they, in the cases I'm about to show you, have said, you're the intermediary, you should figure these things out, even when it comes to the method of the design, whether it's an RBF or a DIB. So here's the first exhibit for that. And this is a really interesting project. We had a donor come to us and say, so what I would like to do is, in sub-Saharan Africa, I would like to pay for increases in income, preferably household income. I'm also interested in assets and consumption, and then there's some commingling there between income and consumption. But I basically want to see increases in income. I want that to be achieved through either an agricultural program or a workforce development program. That's just something that as a donor I'm really interested in, as an outcome pair I'm really interested in. I've looked at ultra poor graduation programs. I've seen that some of the ones that IPA is evaluating, there's an increase in income of about 15% year on year. I know not every program, and in fact maybe very few programs will have that type of statistically significant increase. But if you can find me that type of program, if you can find it for me in sub-Saharan Africa, and if I can evaluate it, I'd like an RCT, but I'm not tied to it. I'd like it to be independent, and I'd like to have a counterfactual. But if you find that, bring it to me, and I'll be your outcome payer. Very interesting proposition. And we said, okay, so would you be willing to pay investors for interest if we find that the service providers can't take on that risk? We need to do a DIB, talk to investors, and so on. Would you be willing to kind of spend more time arranging it, and so on? And the conversation was very simple. The donor basically said, don't bother me with any of this stuff. Bring to me this program. Show me this outcome that I can purchase out there in the world. And then if you tell me the outcome is $10 and $2 of that just to an investor, because that's just the cost of that outcome, because that's the structure you think is the most reasonable, then it's $10. And if I find that to be reasonable, I'll pay for it. If that turns out to be an RBF, where all of that $10 goes to a service provider at the end of the program, and only if it works, then that's an RBF. But the exact nature of that design, I'm agnostic about that, which I thought was really interesting. So that's one program we're working on. And another exhibit is a diabetes program that we did the first phase of that in Mexico, and we're now working on the second phase. So again, we had a donor come to us and say, what I really want, and this was a health agency in Mexico, is, so we have a problem. They said in Mexico, about 14% of the population has diabetes. It's a very easy to identify population, but when we start to try to control diabetes in that population, we run into problems. It's basically a runaway problem. Diabetes at its worst leads to loss of life, limb. This is a terrible disease when it gets out of hand. And of course, also not so nice even when it is managed. However, they think, boy, if we can manage that disease within even Mexico City, that would be a phenomenal social outcome. And they're willing to pay, as you see here, this is kind of all of these are temporary term sheets for all of these projects we're working on. They're saying, well, if you can take a cohort through a 2-year diabetes management program, we'd be willing to pay actually quite a bit of money. And again, we started the conversation with them about whether they would politically be interested in a development impact bond, whether that's politically palatable to them from an optics perspective, whether from a procurement perspective that's something that's possible for them. And again, we reached that very interesting part of the conversation where they said, we just want to issue a procurement notice where we would pay the $20 million over 2 years for service providers that would create for us a diabetes management program that controls hemoglobin levels, cholesterol levels, blood pressure levels. These are the 3 outcomes that we ended up creating and realizing are the key outcomes for this program. But again, don't talk to us about the difference between RBF and DIB. The whole investor piece to us at this point is not interesting. As you design it, think of this design as being a design for an outcomes-based program. We would procure it as such, and then again, if this is something that a service provider, if this is a large health management service organization that comes to us and it has internal funds, its cost of capital is very low because it's borrowing from its own bank account and so on, that's a scenario we'd consider. If it enters into an agreement with another financial institution to borrow from that organization, that is, again, something we will consider. But that, to us, actually, in a very interesting way, is a secondary issue. So that's the second lesson that we have been seeing in the market, at least in some of these programs, where outcomes payers are often indifferent between RBF and DIBs. So lesson number 3, and the final lesson, is when moving from an RBF to a DIB, investors ought to take care that service providers are incentivized. And what I mean by that is when we think about RBF, as I've defined it before, this is a program where you write a contract, you enter into an agreement with a service provider, and you say, I'll pay you at the end, and only if the activities you delivered actually created outcomes, social outcomes that I'm interested in and have been independently evaluated. Now, that means that the financial risk is on the service provider. And SIBs and DIBs, by definition, if you are not careful about your design, the financial risk is all on the investor, which is another way of saying that the service provider, there's reputational risk there, but who knows how exposed they are to that reputational risk. Maybe they're one of 20 different providers in this program, and they're much less known than the big provider in that program, or something similar to that. Put in other words, when you transition from an RBF to a DIB, you remove that financial incentive, which doesn't have to be the case. You can keep it there, and that's what we're learning people are very interested in doing. So the first example in that is actually not in international development, but Massachusetts is a social impact bond I worked on before I helped co-found Instiglio. And in the Massachusetts program, there was originally a design that had all of the financial risk be put on the small number of investors that were putting money into that program. As the design was being amended and iterated, it changed, and exactly 15% of the financial risk was put on the sole service provider that is part of that project, called ROCA. So there, ROCA faced a reputational risk. So everyone knew it was delivering this program. Boy, it would be hard for them to get another contract from the government if this failed in a very publicly visible way, if they failed to deliver in a very publicly visible way. In addition to that, and the important thing for this slide is that they were actually an investor into this, which is to say that they would not get 15% of that amount of money back. They would get the rest of it from the investor, some of it up front and some of it according to the milestones. But 15%, if they delivered no outcomes, they stood to lose that. In addition to that, the investor took additional care to make sure that the service provider delivered these outcomes because they're, again, less exposed to the financial risk. And it hired performance management services to deliver those services to ROCA. It went out, found a specialist in data management, data collection, data analysis, tying that data to decision making and so on. So a performance management consultant, and paid for that consultant to advise ROCA. That's Exhibit A. And Exhibit B is the Educate Girls Development Impact Bond that Phyllis so eloquently described earlier. And again, in this project, what we're seeing, and this is the general term sheet for it, so what we're seeing is the service provider, again, in a very abstract way, doesn't necessarily have to take on any of the risk. So what's happening in this program is that over the course of these negotiations, the service provider first may take on some of that financial risk. Second, the investor will pay for performance management to be delivered to this organization, to this service provider. And thirdly, the investor will also monitor the service provider quite carefully. All this to make sure that outcomes are delivered, and in my opinion, to also just offset the fact that service providers and DIBs are not by definition necessarily incentivized financially. So those are the three lessons. RBF sometimes is a useful precursor, a useful pilot for development impact bonds. I think that means that RBF can be used to build service provider capacity, to demonstrate the value of outcomes-based funding to your reluctant government or your reluctant development agency. And in general, I think it is just a simpler, smaller model to start with. The second lesson, that payers are often indifferent between these models. I think that means that on the one hand, we have seen that. On the other hand, that also means that service providers and the designers of these DIBs and RBFs should really take care to mind that difference, because it matters to the service providers quite a bit, and to the investors quite a bit, of course, because one is their presence and the other means their absence in this program. Lesson 3, when moving from an RBF to a DIB, investors seek to keep service providers incentivized. And as I just showed you in these two exhibits, they can do this by putting money at risk. But they don't necessarily have to do that. They can also do that by withholding money, so based on milestones. And then they can also do that by purchasing service performance management capacity, or building up service provider capacity in a DIB. So that's the end of my presentation. 3 lessons.
Yeah, Richard Morton, GRM again. Actually, my question is going to be a little bit on the same theme as my one this morning, but coming at it from a different direction. So firstly, my question is it a misnomer to call it a development impact bond when it's really development impact equity, in that the provider of the capital is taking a risk of completely losing their money? It's not a loan, is it? Mm-hmm. Which is the traditional definition of a bond. And that leads on to the second question, which is, if that's the case, isn't it preferable that the equity holder also controls implementation, as in the case again of a private contractor such as ourselves or Comonix or whoever? They're providing both the equity and they're controlling the implementation in a results-based finance model. So basically what I'm saying is, what are the circumstances in which it's actually preferable in that case to move to a bond model?
Got it. Okay, so good questions. On your first question, technically a development impact bond is a quasi-equity instrument that has the downside of equity and the upside of a bond. So that doesn't sound very appealing. DIBs, much more appealing. But you're right that technically that definition is a bit of a misnomer. On your second question, it is not always the case that an equity holder also has control. Equity holders may choose to exercise a variety of levels of control. And what we have seen is that this differs in different SIBs. So the one in focusing on recidivism in New York was a SIB where Merrill Lynch cut up the money into pieces and sold it to high net worth individuals. These individuals have no agency over the program. They have no, not too much, I mean some, but not too much visibility into the program. So there you go. Those are the two components of control that they completely lack. They don't see it, and they can't really touch it, even if they did see it. There are other programs, and I think the Educate Girls did, but it'll be interesting to see what comes out of this entire process, because I'm guessing that the sole investor will have more control than we saw in the New York social impact bond. So it will vary in these impact bonds as well, or quasi-equity instruments.
Thank you. My name is Ingrid Hagen. I'm from Chordate. We actually talked to each other on the phone like 2 years ago.
I remember.
Ah, good. I have a question. We have probably about 11 RBF programs.
Mm-hmm.
Some of them are very large, so you're talking the 40 million. Afghanistan is one of these environments. We have the transparency on the data collection. We have the transparency in the outcomes. The structure is functioning under an RBF. What are the conditions that are needed to move to a DIB? If we're talking about investors, not grantors, investors that have a return. What needs to happen in your view to be able to make that transition?
That is a really good question. I think that for some of the programs in your portfolio, it is not necessary to move that program to a development impact bond. Another way to define this development impact bond idea is to say, well, you'd like to write a program where you pay on results that are evaluated independently. You'd like to have that program be very large. You'd like it to last for a very long period of time so that those results, there's kind of concrete focus on them, prolonged, enduring focus on them. And you'd like to give providers flexibility to alter their business models as they see fit on the ground. If you can manage to do that without introducing an additional party into this by having one NGO instead of 20 or by having 0 investors instead of 20, then you have created a more efficient model. And that sounds fantastic to me. What we have seen, and our organization is much younger than yours, but what we have seen in our small number of RBFs is that, and in some other RBFs that have been deployed by others, is that they tend to be smaller than DIBs. They tend to be such that not all, some otherwise qualified and competent providers cannot bid on them because of the risk they would expose themselves to. So in those situations, a DIB, I believe, allows more providers to bid and more providers to kind of demonstrate and test their models.
Sorry, indeed, maybe it's in my mind, having grown up in a capitalistic society, that one should try and make a switch or a move towards a private capital market base, whether it's pension funds or private individuals with a return advantage versus being dependent on donor money, so to speak, for a long-term perspective. So that's something in my mind, if in a place like DR Congo or Afghanistan, is there really actually an opportunity to consider that a private capital base would want to be involved in order to work in a SIB or a DIB structure in order to support such a context? Right now it's 95%, if not completely donor dependent, and for the foreseeable future. So if you want to move away from those kind of capital streams, is it feasible? Are there conditions that would ever, be able to make that happen?
I see. Okay, so I can answer that as well. You'd really have to take a look at what risks the program is exposed to, and I think there's an opportunity in places like Afghanistan or other places where there are significant political risks, significant exogenous risks, to say that we can disaggregate the risks and look at them separately. One type of family of risks pertains to the ability of the program to perform in any environment, just the quality of the staff, the NGO, its ability to, its actual impact model, and so on. And the other pertains to the outside environment. And you could have a scenario where an outcome payer says, if given the environment is good, I'll pay you based on performance. But we can introduce some caveats where if the environment goes haywire, then we kind of talk about that. And maybe I pay you even if I don't see outcomes, because we have agreed, or reimburse you half of your money because we have agreed that a serious degradation in the environment and complete kind of erosion of the ability to do any work triggers kind of a recovery of half our costs or something like that. So that's it's definitely possible to do it even in very volatile environments.
Yeah, Tom Sanderson, BBC Media Action again. I think I'm maybe like many of us, we're beginning to get our heads around this now. And the Chordate example is a good one. As a service provider, under a results-based contract, if I understand it correctly, you guys get paid at the end after you've done all the work and you've delivered the results. But under a DIB, that same service provider would get paid at the beginning by the investor to kind of do the work. So for them, the kind of cash flow, the discounted cash the kind of present value of the funding is much more attractive for the service provider to be in a DIB framework than in a RBF framework. So maybe it's the service providers who are the ones perhaps exerting more pressure to kind of push down this road. Let's do this, because then we get our money early and we pass the risk on to the investor. Are you seeing that?
I would say that 70 to 80% of our inbound requests to help with DIBs come from service providers, NGOs. So yes.
Sorry, this is Marissa from World Vision International in Geneva. And I guess this is just reflections of sort of also like getting my head around what I've just heard, or sort of across sort of, or from between this morning and just now. I wonder if the SIBs or DIBs is, and I wonder if there's a tension between the notion of a DIB fostering innovation versus fostering effective implementation of proven sort of initiatives or solutions, because, and I guess it depends also on which model you're looking at, and then also reflecting on just a question now from the colleague from the BBC, I guess, especially with the RBFs, they would not necessarily be incentivizing innovation, because in the end, if you're not delivering your outcomes, then you wouldn't be rewarded for that. So it's not essentially incentivizing the risk of actually being innovative. Does that make sense?
So I think that the interesting DIBs, the interesting RBFs out there, are ones where you don't know a priori whether the result is going to happen or not. Because if you really were certain that what you were about to do was going to produce the outcome you were looking for, then you shouldn't go through the trouble of structuring a DIB. As social finance has told us, it takes time. And those are the interesting cases. There are some cases that are, to your point, some of these more simple immunization programs. The World Health Organization just has the protocol on its website. You download it, you execute the protocol, and your kind of ability to adhere to the protocol is whether or not it happens. But if you adhere to it, the immunization rolls out and fairly successfully. I mean, I'm kind of generalizing here, but those are the types of interventions where you pay for activities because you're fairly certain that successful delivery of these specific activities get you to your end goal. It's where the intervention is more complex, such as the more complex immunization set of protocols that social finance is developing in Uganda, or the complex educational environment in India, where you really are not sure at the beginning. So you would say otherwise, I would actually pay for this program if I was paying for it at the beginning, because I'm not really sure whether I have to then stand in front of Parliament and tell them, well, I thought the money would go to a fairly reasonable place, but who knows where it went. But with a DIB model, you're more likely to take on that risk because the risk is moved away from you to either an investor or a service provider. Thank you.